Hello, everyone. My name is Dr. Sylvie Shuttleworth, and I am the Department Chair for Counseling and Health Psychology at Bastyr University. And I have the pleasure of being here today with Cristal. She is one of our Master's in Counseling Psychology students and a very impressive student because she actually is also in the naturopathic medicine program. So thank you so much for being here with us today, Cristal.
It's a pleasure being here, Dr. Shuttleworth.
So, Cristal, I was wondering for the folks listening in, what is it that drew you to mental health? What made you want to add this on in terms of your career?
Yeah, it was summer going into my senior year in undergrad that I participated in an internship, a summer internship that required me to um, work with mental health professionals. I was basically developing a blueprint for this mental health app for youth, and in these it was just a 10-week internship, but during this time it clicked with me that I was like, I don't know why I never pursued or decided explored the possibility of a career in mental health. So, it's something that I have personally struggled with. I've seen many people in my family and in my communities. So I know it was something that needed to, it was a field that needed more professionals for sure. And I'm all for, trying to fill needs. And so, yeah, and it's a huge part. I mean, mental health is health, it's a huge part of our overall health. And so, pursuing, being a pre-med student and, wanting to heal others and then seeing how much of a need there was for mental health services, that's what ultimately, led me to decide, okay, I'm also going to pursue mental health. Mm-hmm.
That makes a lot of sense. So it sounds like, in your journey on the medical path, realizing that, yes, treating the body and the physical ailments, but so much of that is also connected to one's mental health and the interconnectedness between the two. The other piece I heard you say that I really want to highlight that is something we hear from a lot of folks in the field of mental health is the draw to the field because they find it rewarding. It brings them purpose. It's fulfilling for them. They see a need and they want to be part of that process and helping people on this journey. So I really appreciate you highlighting those pieces. Then you picked the Master's in Counseling Psychology program at Bastyr University specifically. So I was wondering if you could share a little bit about that.
Yeah, so it's pretty much related to what I was already saying. And the counseling program at Bastyr, for me has proven to be definitely more not only accepting, but like fostering this partnership with other modalities. So, naturopathic medicine, treating the whole person. And as we've already talked about, mental health professionals are helping to address that whole body approach. So, and specifically Bastyr's program, really, I find has really well merged those ideologies. It's not keeping things separate. It's really taking the whole person into consideration. And so that's what I'm all about. And so, yeah, I mean, and really that integrative approach part is key for me. And it's something that I, after graduating, want to continue that and ultimately want to open up a practice that, is able to offer both, have several other people besides me, of course, and be able to offer counseling on top of naturopathic services. So yeah, it was a perfect fit for me, for sure.
Yeah, I like what you're highlighting there because you're talking about this integrative, this holistic approach. And I mean, literally, we have a class called Whole Person Healing in our Master's in Counseling Psychology program, which you don't typically see in other Master's in Counseling Psychology programs. And then I wanted to mention this piece, and I guess, Cristal, this is where you're more of a service to other students, but in our small cohort model, it's pretty common that we have naturopathic medical students taking the same classes because they're doing a dual degree. So you get to hear their expertise in terms of what they're learning in their other classes. And yes, we hear this, we're talking about this mental health piece and like, oh, but I was also wanted to add this other piece I learned in my class on the medical side. So it's a really beautiful environment that we create in terms of discussion, where you have med students and their students, and then other students that come from unique backgrounds like yoga and specialties in breath work and things like that.
Yeah, definitely. That's something that I really enjoy about being in class, is again, that not only acceptance, but this curiosity of like, oh yeah, that's another important piece to it too. And, I mean, all important things to keep in mind as a future counselor, when we're meeting with people and working with them.
Yeah, that mind, body, spirit
Mhm.
connection. Cristal, I was wondering if there a particular maybe class or course that's stood out for you in the curriculum that you've taken so far that yeah, just left a memorable mark that you wanted to speak to.
Yes, for sure. There's actually, I mean, I've loved every course, honestly, but if I to highlight a couple, one was the lifespan development course. It really helped answer and fill in a lot of blanks that I had for me personally, and also just kind of it broadened my worldview and my perspective on the world and how people develop, and certain reasons why there may be some struggles in some areas. And the other one is the multicultural class. So we did a lot of I mean, and all these classes require a good amount of self exploration. In that class in particular really had us think what our backgrounds were, what that background had, how that influenced the way we see the world, our opinions, potential biases. And so it really was an opportunity for me to take a pause and reflect on all of these important things that, again, as future counselors is important to consider, because I definitely aspire to work with a variety of different people from different populations, different backgrounds. And so whether, we are aware of it or not, we definitely have our biases. So I really, really appreciated that opportunity it was a very humbling experience, and the professor was great, Desiree. She was, yeah. So shout out to her.
Yeah, so highlighting and thank you for acknowledging our amazing instructors, and also highlighting that going into this field or pursuing this type of degree, that it involves a certain level of self-reflection, personal growth, so that we're aware and not bringing in our own blind spots or biases in terms of the treatment that we're providing to our clients. And then piggybacking off of that, so we do offer we have a teaching clinic at Bastyr University, and all of our counseling students go through this clinic providing counseling services to patients within the clinic. And Cristal, you're on a shift right now in the clinic on one of our counseling shifts. So I was wondering if you could speak to that a little bit, anything you'd like to share.
Yeah, I mean, obviously at first it was pretty nerve-wracking. We talk a lot about the theory of counseling in class, but then actually applying it is a whole nother experience. So I've definitely, although I was very nervous, I am very happy to start my experience, to start, really refining those skills and learning new skills. I have been, since the first week, I got to see a patient, and I've been seeing her weekly. And so even now, I think it's already been like 4 sessions, and I've seen improvement. And so that right there is very exciting, because you're like, yes, I mean, not that I didn't believe in counseling before, but it's a whole, like, it just really makes it a lot more real when you're able to actually apply these approaches with an individual and help them, uncover their potential as a human being, and achieve whatever goals it is that they want to achieve. And so, yeah, it's very, very, very rewarding. And, getting the feedback, getting the guidance from, my supervisor, from my peers, super, super valuable, super appreciated because ultimately, once we're out of here, it's kind of like we're kind of on our own. I mean, not entirely. I know there's still some more supervision required, but anyways, yeah, it's exciting to finally be practicing what we've been learning and seeing and helping, people with their struggles. Yeah.
Yeah, it's one of the, I think, pieces that sets our program aside is that in the first year of the program, we have our students go into the clinic and provide direct services under live supervision. And after they've had, a number of courses and quarters under their belt, but still in their first year. And I think that sets us apart in that when they go in their second year, when they're going into the community to do practicum, their clinical training experience, they have a bit more confidence and feel more poised because they've already gone through some of this supervision and training in our own clinic. So I'm glad that you're also experiencing it in that way. Cristal, I mean, any words of wisdom or anything that you would like to share for prospective students, or maybe something you wish someone had told you when you were looking into these things or considering the program?
I mean, I have two things to say. One is really, I'm a big believer in, that gut feeling that we get, right? That intuition. And so if, following what your gut says, and, for me coming to Bastyr, it was, a lot of it was just like a gut reaction. I was like, I know this is what I want to do. And so, don't doubt yourself. Don't doubt, if you're feeling pulled to it, go with it. It's definitely scary to, many people may be, stepping out of their comfort zones and pursuing something like this, but definitely follow your intuition, number one. And number two, this was a piece of advice that I actually heard in my first year here at Bastyr, and it's don't sweat the small stuff. That is so important. Until this day, I repeat that to myself, because there are so many there's going to be so many little assignments and so many things to do, and it can seem very overwhelming because you're looking ahead, and I know many people tend to kind of think about the future and all of that stuff. And so what has really helped me in this process has been to just remind myself to not sweat the small stuff. Everything's going to work out, and it has been, and so yeah, that's what's keeping me going.
That makes so much sense. So trusting one's intuition, what they're feeling that they're being called to, and then when you're in it, keeping perspective on the big picture, and an eye on the forest and not each little tree within the forest can help to keep people going. We are so honored to have had this time with you, Cristal Salcido, one of our exceptional Master's in Counseling Psychology students within the program at Bastyr University. Feel free to look at more information on our website if you're interested in pursuing this degree yourself. We are accepting applications, or if you're interested in receiving counseling services within our university clinic, we're happy to provide those as well. And you can find more information at Bastyr.edu. Thank you so much, Cristal.
Thank you so much, Dr. Shuttleworth. It's an honor to be here and share my perspective.
All right. Wonderful. Well, take care.
You too. Bye-bye.
Bye.